good evening and welcome to Doctors on Call. What would you like to know about cholesterol and its relationship to heart disease, exercise, and diet? Well, that's what we're talking about tonight. I'm Dr. Alan Johns from the Department of Family Medicine and Community Health at the University of Minnesota Medical School Duluth, and I'm your host. I'm pleased to welcome our panelists. Dr. Joseph Doerer, a cardiologist with Essentia Health St. Mary's Vascular and Heart Center. Dr. Jake Powell, an internal medicine physician with St. Luke's Internal Medicine Associates. And Dr. Paul Sanford, an internal medicine physician with St. Luke's Internal Medicine Associates. We're ready to take your questions about cholesterol problems. Give us a call. Locally, you can call at 218-788-2844 or toll free at 1-877-307-8762. Our medical students answering phones tonight are Rachel Grunin of Osakis, Minnesota, Laura Lotka from White Earth, Minnesota, and Emma Osby of Spicer, Minnesota. And now on to tonight's program. Well, Dr. Doerer, you're a cardiologist, and obviously people you see have heart problems. Is high cholesterol pretty common among all your patients?
Oh, very much so. We also deal with other problems such as arrhythmia, but our patient population tends to be older, and we deal with a lot of coronary artery disease, peripheral artery disease, people with cerebral vascular disease as well. There's a lot of overlap. So yes, we're very in tune with cholesterol and how to treat cholesterol. A lot of the new guidelines have, luckily for us, made it a lot easier for us in our decision-making tree, but it's something that I do every day.
Well, great. Yeah, I'm sure you do. Well, we'll get to that again more later. Dr. Powell, tell us about, there's different types of cholesterol, right?
There is, yeah. So when we check a cholesterol panel in the office, generally we'll get four components to that. One is the total cholesterol, which is kind of a combination of everything. And then something called HDL, which we refer to as good cholesterol, and most importantly, LDL, or bad cholesterol. And then often included in that is another fatty molecule called a triglyceride. And so those are the four components that we check.
So do they all cause problems?
They all have their own role. Typically, when we're talking about heart disease, LDL and its ratio to HDL is probably the most important thing that we're looking at. Triglycerides are more of a prognostic factor for developing diabetes. At very high levels, they can cause their own set of problems, inflammation of the pancreas and that type of thing, but they all have their own role, yes.
Okay, thank you. Dr. Sanford, what do cholesterol come from in our body? Now, okay, we were eating some chocolate chip cookies before we came out here tonight, the truth be told. And is that where we get our cholesterol from, or does the body make it, or what?
Any carbon will make cholesterol. Now, you can sit down and eat a bowl of cholesterol. Virtually none of it will end up as cholesterol in your arteries. The vast majority of the cholesterol built in your own liver is made just from two carbon fragments, acetyl-CoA. And you can get that from sugar, from bread, noodles, junk food, healthy food. But generally, the fewer calories per meal, the better. So keep eating your green leafy vegetables and try to avoid eating cheeseburgers too often, and things would be okay.
Okay. Well, thank you. Well, Dr. Doerer, you mentioned something about guidelines in treating cholesterol. There have been some new guidelines came out. You mentioned it made things easier, or does it make things more confusing?
Well, I think in some ways easier, and in some ways a little bit more confusing, because sometimes you have patients based on the old guidelines who are well controlled on something like simvastatin, and they have, based on the old guidelines, the LDL level that's at a good level, and say it's about 70. No, well, they have coronary artery disease, and the new guidelines suggest that they should be on some type of high intensity statin if they've already had a heart attack or some type of event, and then you have to look at the pros and cons of putting them on something that's more intense, and it could drive down their bad cholesterol lower and potentially have rare but side effects that could happen. So in that way it was a little bit more difficult, but in general I think it made it a lot easier. It was a simple algorithm, especially for a cardiologist. If they've had an event, there's two good choices: Lipitor, Crestor, or atorvastatin or rosuvastatin are their generic names. And these medications have been proven to help prevent future events and to treat coronary disease.
So pretty much anyone who's had coronary artery disease problem, a heart attack, should be on a cholesterol statin.
Yes, and we've had many different types of medications, from things that are over the counter like fish oil to a lot of people have been on niacin before and have had that flushing problem that everyone knows about, to Zetia, to many others. But statins have been proven to be the best, and I really try to get people on statins and keep them on statins, and will do my best to even alter how often they take it during the week to even try to get it on board.
Great, thank you. Dr. Powell, caller from International Falls would like to know, is it true that people that have extremely high cholesterol live the longest? Wonder if she means high HDL?
Yeah, I would say in general, extremely high cholesterol would not correspond with the longest living people of our society. But some types of cholesterol, HDL for example, some people you'll check their cholesterol panel, they'll have an extremely high HDL, which is a good thing, that's positive. And so generally you'd think those people would have better prognosis, but as far as overall cholesterol, I would say that's probably not an accurate statement.
Okay. Thank you. Dr. Sanford, a caller from Duluth would like to know, is high cholesterol caused by egg yolks, or what about eggs and cholesterol?
Eat your eggs. Eggs are good for you. Again, eating cholesterol doesn't cause cholesterol to go up. When you eat an egg, the cholesterol that's in the yolk is broken down into simpler hydrocarbons, and your body will absorb 2 carbon fragments nicely, but it won't absorb the huge 27 carbon molecule that cholesterol is. All the cholesterol ends up in your arteries is built in your liver. And so eat your eggs. They're great food, perfect protein, low calorie. They're good for you.
Okay, thank you. Dr. Doerer, a caller from Superior who has had a triple bypass. It's on 80 milligrams of simvastatin. What's the likelihood that the cholesterol will rise again if I'm on this medication? I guess meaning how effective is that medication?
Well, that's a good intensity statin dose. I would say at least a moderate intensity statin dose, and depending on how old he is, that might be appropriate, especially people over the age of 75. I would say that's an appropriate dose. The chances of it going up, it's lifestyle. Lifestyle modification is very important, and the guidelines hit it very hard, even though I think we overlook it and we talk about statins, but it's just as important as the statins. So really watching your diet, getting out, being active, that should help prevent that cholesterol from going higher.
Thank you. Dr. Powell, a caller from Duluth. Should be a patient of mine here. If you lose weight, can your cholesterol get too low? And this person is on a high protein diet, cholesterol is going down, but is that healthy?
The first part of that question, can your cholesterol get too low with weight loss? Probably not. We don't really think there is a too low. There might be, but we're unlikely to do that with weight loss alone. What was the second part again?
He's on a high protein diet and his cholesterol is going down. Is that healthy?
I think in general, a lower cholesterol would be considered healthy for most people, yeah. A high protein diet is not a bad thing to do.
Sounds like this person is doing the right thing.
Sounds like it, yeah.
Very good. Dr. Sanford, we have a caller from Aurora. She has a high cholesterol and she's tried many statins and keeps getting leg cramps from them. What can she do?
Well, if the cramps are limited to the legs, it makes it less likely that it's the statin. If statins are going to cause muscle or liver trouble, generally every muscle in your body will be thriving. And in the 25 years I've been doing this job, I've seen that in 2 people out of 20,000. It's extremely rare. So if it's just cramping in the legs, not likely it's going to be the statin. But when in doubt, go off of it for 2 weeks. If the discomfort goes away, then restart the statin. If the comfort comes back, then you'll fulfill what's called Koch's postulates and have shown a possible association. Does that sound legitimate to you guys?
That sounds legitimate, and if that's the case, there's other options, other statins to try. So, and different ways of taking them. So if one doesn't work, I move on to the next.
Yep.
Okay, Dr. Doerer, caller from Chisholm, again, still talking about the potential side effects. Are cholesterol medicines associated with fatty liver disease? Or maybe I could add to that, are what is the risk of liver problems when taking cholesterol medications like statins?
So not fatty liver disease, probably the lifestyle that leads to the high cholesterol relates to fatty liver disease. There is potential liver side effects, luckily very, very rare. And usually what I do is, and it's not necessary according to the recent guidelines, but I do check a baseline liver enzymes, and then if I have any inkling that there's some type of liver issue going on, of course you can see if it's related to the medication. But luckily the liver side effect is very rare. I can't remember the exact percentage, but we're talking pretty rare.
Very rare. Yeah. Thank you. Dr. Powell, a caller from Duluth, would like to know, this is a simple question, butter or margarine?
Oh, well, I think either one in moderation, but I think probably butter is the better choice. But getting back to Dr. Sanford's point, it's with your diet, it's not so much what you eat, it's how much you eat, and it's total calories. And so either one of those, you probably don't want to overdo it, but I probably wouldn't go out on a limb and recommend one over the other. Moderation, that's the key.
A caller from Duluth has an interesting question. Why don't they ever talk about the size of cholesterol or a test for that?
Oh, interesting.
Like
Yeah,
chylomicrons.
chylomicrons, and for a while it was a big popular thing. You had large and small HDL differentiation, and there was all the hot issue on whether or not niacin would help to improve the protective aspects of HDL, high-density lipoprotein, or good cholesterol. And it's been pretty much just debunked. It really hasn't been shown to be a benefit. So, the size and shape of the cholesterol, high density helps to mobilize the cholesterol off the walls of the artery, and low density lipoprotein has a tendency to be shoved onto the walls of the artery.
And that kind of gets to one of the questions. Also a caller from Duluth, what is good cholesterol and what is bad cholesterol? So the HDL is your good cholesterol.
Yeah.
What does that do?
Well, HDL, good cholesterol, helps to mobilize cholesterol off the linings of arteries. LDL, or low density lipoprotein, is what's often stored on the arteries. Our body, when it makes cholesterol, builds it and spends a lot of metabolic capital to do so, because cholesterol is a major building block in a lot of the metabolites that our body uses, estrogen, testosterone, a lot of the hormones. It's the only thing our body makes that we store in the artery wall. And in the old days, the average lifespan in 1900 was 39 years. People died of getting eaten by a bear, or tuberculosis, or smallpox long before they ever had a chance to be diseased by cholesterol. Mm-hmm. But a child born today can expect a life expectancy of 85 plus years. So, again, as Dr. Powell says, everything in moderation, nothing in excess.
Okay, thank you. Good advice. Dr. Doerer, a caller from International Falls would like to know, what time of day should I take my statin?
Oh, fantastic question. Actually, there's a little biochemistry with that. And it depends on the medication. So something like simvastatin, it's best to take at night because a lot of the cholesterol synthesis that goes on, it happens at night. Now things like Lipitor or Crestor, these are more long-acting statins, so it really doesn't matter as much when you take the medication. But there's some that actually do matter when you take it, and it has the best benefit, and simvastatin is one of those.
Thank you. Well, Dr. Powell, I've got two callers here. I'm going to combine their question. How effective is either red yeast rice, tongue twister, or Metamucil? Do either of those help cholesterol?
They both do to some degree. So red yeast rice is a supplement you can buy over the counter that has a very small amount of one of the naturally occurring statins. I think it's lovastatin, which was the original statin, which was discovered to be produced by this particular yeast that grew on this red rice. And so it does help, but not nearly as much as a prescription. For some people who just cannot tolerate a prescription or who will not take one, it's an option that I will go to sometimes. Metamucil is probably a little less effective, but Metamucil binds it in your gut, and so that fiber helps to eliminate some of it into your gut. There is a small amount of that gets absorbed into our body, and like Dr. Sanford said, mostly it's manufactured in liver, but Metamucil helps to get rid of some of it in your gut. Any high fiber diet will do the same thing. If you can get your fiber through natural sources like fruits and veggies, that's the way to do it. If you can't, Metamucil's not a bad thing.
Thank you, Dr. Sanford. We are combining another couple of questions. We have callers asking about triglycerides. So what's the story with triglycerides? How are they harmful, or are they harmful?
Well, triglycerides, especially with the large Finnish population up here, Sisu Salmi, there's a type of hypertriglyceridemia called type 4 hyperlipidemia that we find a lot in the Northland. Triglycerides are a long-chain fatty acid, and they have a role in membrane synthesis, brain tissue. But the problem is that too much of it, if you're getting up more than 150, 200 for a level, it can cause arterial disease. So you look for these things called xanthomas, where you get little plaques of white stuff on the temples or on the palms or the wrists. And you have to have your blood checked for that, and sometimes you want to treat that using some type of a fibrate medicine, and mostly just eating your spinach like Grandma told us to do, and just keeping lean and mean.
Thank you. Dr. Doerer, a caller from Ashland would like to know about fish. Can eating a lot of fish help your cholesterol?
Well, there's the Mediterranean diet, which is heavy in fish. I think it's there's no general consensus, but I think at least 3 servings throughout the week at least. And that diet has been proven to be good for your heart, but in general, I think it's a good meat. It's a good source of protein. What I'm trying to get down to is, eat your fish. So,
Fish are good.
fish are good.
How about fish oil pills? Anyone?
Probably not as good as real fish, but
Yeah.
if you can't get, a lot of people can't get enough fish in their diet, so that's one way to do it.
Okay, thank you. Dr. Powell, a caller wondering about, what about niacin and lowering cholesterol? You can get niacin over the counter.
You can, right. And so niacin, in my experience, I haven't found anyone who can really tolerate taking niacin. And it's really kind of fallen out of favor. So in the old days, before we had statins, this was even before I was a physician, niacin was one of the only things that we had to treat cholesterol. But now, with the newer meds, I think niacin's place in our regimen is kind of minimal at best.
So what kind of side effects do people
Flushing. People, so they get this like a massive hot flash is what people experience. And it's almost universal. Almost everyone gets it, and most people cannot tolerate it.
Thank you. Let's see. One of these calls asked already about taking statins at night versus the day. How about alcohol? Dr. Sanford, how about alcohol? What's the role of alcohol in cardiovascular disease?
Well, it's mostly calories. When you think about a can of beer as being half a loaf of bread in terms of calories, that's probably the major thing. Alcohol in itself puts more stress on the liver. It's just generally not a healthy food. Everything in moderation, again, just like Grandma used to tell us. The biggest thing is not smoking. If it weren't for cigarettes, we'd be polishing cars for a living. So, better off without alcohol or cigarettes.
Very good. Very good. Okay, Dr. Doerer, caller from Duluth would like to know, I had a stent put in a month ago, but I have a blockage. There must be another blockage. Why wouldn't they take care of both blockages? I guess it gets to the question, well, how significant is the blockage?
Oh, good question. It does depend on how significant the blockage is. What I tell my patients are, unless you're having an acute heart attack, the stent might, will probably save your life if you have an acute heart attack. But in general, good medications is the staple to good heart care. And luckily, our bodies, if you do have a total blockages, our bodies can build new blood vessels around that. And as long as you're not having a lot of chest pain or having a lot of heart failure, it's best to treat these patients with good medications, and statin being one of the staples.
Thank you. Dr. Powell, caller from Chisholm, would like to know, is there association between high blood sugar and high cholesterol? And that might morph into a question about, what do we do with diabetics with high cholesterol? Are they treated any differently?
Right. So high blood sugar and high cholesterol are generally associated with the same type of lifestyle. So sedentary, not active, too many calories, too many carbs, and some genetic component too. But it's a lot of it's lifestyle. Getting back to diabetics, absolutely higher risk for heart disease. We do treat them more aggressively. Generally speaking, when I see a diabetic, I think of them as already having heart disease, even if they have had no symptoms and no history of it. And so we treat those people because we know the risk is so high. Generally, we all treat those people as if they already have heart disease, and by doing that, I think we're able to prevent a lot of heart disease and stroke down the road.
Thank you. Dr. Sanford, a caller from Two Harbors, would like to know about the long-term effects of simvastatin, some of the statins. Are there long-term?
Long-term effects are living longer. The main reason we address cardiothoracic surgeons these days as, hey, waiter, is because of the statins. It's absolutely a miracle. The relative percentage per 100,000 people that need bypass surgery today compared to 20 years ago. It's because of the statins. People are afraid of statins. They think that they cause everything from growing another arm to dementia. They don't. Statins are fantastic medicines. They save lives. And if you have heart disease or if you're diabetic, please take your statin, because we want you to be alive for my retirement party in 2028.
Great. Hopefully I'll be there.
I hope so too.
Dr. Doerer, a caller from Wisconsin would like to know if you're on a statin, should you take coenzyme Q10 also? And then there was another caller, so that's a popular question.
Good question. I know some people have taken it, for the side effects about the muscle aches, and I mean the true muscle aches from a really bad reaction, like we said earlier, is really generalized all over the body. But I've had some people where they have little leg cramps for whatever reason. They take the coenzyme Q and the Q10 and they feel better. So I say, has low risk, go for it.
Thank you.
Yeah.
Dr. Powell, another good question for International Falls. They're really got something going on up there tonight. Okay, how do I improve my HDL? I was going to ask this question if somebody didn't ask it. What about HDL? How can I get it higher?
Getting HDL higher is a little tougher. Diet, lifestyle are the big ones. We don't have a lot of great meds that raise the HDL, but losing weight loss in general, more activity, lower calorie diet, that'll help your HDL.
But medications, not so much.
Not so much. One of our statin drugs helps, Crestor, rosuvastatin helps it a little bit, and niacin, but we don't use niacin much anymore. But drugs are really not terribly helpful at raising HDL.
Thank you.
Lifestyle.
No smoking.
No smoking.
No smoking. Big. Dr. Sanford, okay, we talked a lot about statins. We talked about over-the-counter stuff. Are there any other new fancy medications?
Well, there's some injectable forms of HMG-CoA reductase inhibitors or statins that are available that are given once a week, once every 2 weeks.
Yep.
I've never used them.
I hear they're expensive.
They are horrifically expensive, but they're for people that just, even in spite of huge doses of Crestor, can't get their bad cholesterol below 70. So it's a wonderful thing. But the big thing is just going back to how our great-great-grandparents used to live, just eating your fruits and vegetables. At age 18, have 3 meals a day. At age 40, have 2 meals a day, and then one big snack of fruits and vegetables. And after age 60, have 1 moderate meal a day, and otherwise just frequently snack on darker fruits and vegetables. Try to avoid white bread, white potatoes, white noodles. You'll live to be 100 years old, I hope.
Okay. Thank you, Dr. Doerer. A caller from Duluth wants to know, what about thyroid function and cholesterol? Is there a relationship there?
Yes, there is. Especially if you have low thyroid, it can affect your cholesterol. So when we see really high LDL, the bad cholesterol levels, one of the things that your doctor should check is the thyroid function and make sure it's not contributing.
Okay. Thank you very much. And Dr. Powell, a caller from Duluth, would like to know, is there association between statins and developing diabetes?
No, there is not. There was some anecdote. There was a few studies that showed a very loose association, but when those studies were scrutinized, it was, like I said before, primarily they're associated with each other because of similar lifestyle choices. And so statins are used more often in people with diabetes because they need them, and they do not cause diabetes.
So how, just briefly, Dr. Sanford, how do you determine if somebody needs to go on statins or not if they don't have heart disease, if they're just coming in for a routine physical and they've got a high cholesterol?
Okay. Well, if they have other risk factors for heart disease, you already mentioned if they don't have diabetes, if they don't smoke, if they're not hypertensive, then as long as their good cholesterol to total cholesterol ratio is less than 0.3, and as long as they are healthy, you can certainly start with just diet only. But if people's good cholesterol is real low, and the ratio, say, of their bad cholesterol to their good cholesterol is greater than 3, then you can't go wrong with a statin.
Statins are good.
Statin's good, dying bad.
And they are in generic form now, most of them.
Yep.
Nearly all of them. So, well, great. Well, thank you very much. We're out of time. I'd certainly like to thank our panelists, Dr. Joseph Doerer, Dr. Jake Powell, and Dr. Paul Sanford, and our medical student volunteers, Rachel Grudman, Laura Lotka, and Emma Ospey. Please join Dr. Ruth Westra next week for a program on skin problems when her panelists will be Dr. Susan Ash, Dr. Jeffrey Evenson, and Dr. Emily Onello. Thank you for watching, and good night.